I'm gonna assess your neuro system to see if you're alert and oriented. Actually, I would have to do a mini mental status tool. It's like a test to check your neural status. I'm going to assess your olfactory nerve. So I'm gonna ask you to occlude one of your nares and sniff and tell me what you smell.
Lime.
Okay, so your smell is intact and you're able to identify smell bilateral. Checking for your optic nerve. So I would check for visual acuity, for distance, and both eyes look intact. I'm going to check for your near vision. And this is a newspaper. I'm gonna put it above 14 inches away from your nose and tell me what you read on there.
My name is.
Yep, your near vision is intact. I'm going to check for your peripheral visions. Close one eye and not one side, yes, and open the other one. All right, so
Wiggle fingers.
follow my. Okay, your peripheral vision is intact. I'm gonna check for nerve 3, 4, 6 together using my light source, and I'm gonna check for if your eyes are constricted to light. So look at me. Yes, the eye is constricted, and I'm gonna look at it again to check if the other one is constricted. Yes. Your eyes are round, reacted to light. I'm gonna test for accommodation. Just look across my fingers, and it looks like both eyes are concerted and constrict. I'm gonna check for your oculomotor nerve. That's checking for your eye muscles using the big H, okay? Just follow my finger. Okay, I want to check for your trigeminal nerves, and that's right at your temple area. To check for the trigeminal muscles, and it looks like it's a +5. The abductor nerve, and it's also +5. Okay, so the muscles are intact. Going to do the sharpen test. Okay, so you're gonna tell me when you feel dull or sharp. Okay, all right.
Sharp. Dull. Dull. Sharp. 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 Sharp.
Okay, I'm assessing facial nerve 7. And so I'm gonna ask you to raise your eyebrow for me. Okay, down. And then close your eyes tight and do not let me open it. Okay. I need you to smile for me because I'm looking for facial symmetry. All right. I'm gonna assess for the vestibular nerve. I'm gonna ask you to block one ear. I'm gonna speak on the other ear. You're gonna repeat.
My name is.
Yep, we're going to do the Weber and Wine test. First, I'm gonna make a noise with this, and you're gonna tell me when it's stopped. Okay. First, I'm gonna put it on top of your head. Let me know when it's stopped.
Stop.
And now I'm gonna put it behind the mystroid, and let me know when it's stopped.
Stop.
In front of the mystroid.
Stop.
Okay. I'm going to test for cranial nerve and 10 using lighting, and I'm gonna have you say ha.
Ha.
I'm looking for the asymmetrical rise of the self palate. Also, I could use a thumb blade to check for your gag reflex. I'm checking for your spinal accessory nerves. So when I'm gonna push, you're gonna push against my vibe, okay? Good. And now? All right. To check for your hypoglossal nerves, cranial nerve 12. So I'm gonna ask you to stick out your tongue to see if it's midline. Yep, it's midline. Assess for your gross motor strength. So I'm gonna have you walk towards me, head to toe, to check for your balance, okay, and your gait coordination. Yes, okay, turn around, please. Thank you. Look at me. Great. So it looks like your great motor skills or strength are intact, and your coordination's intact as well. You upright and your hands appropriate onto your side, and your gait seems to be steady. And so now I'm gonna ask you to bend your knee for me. Move forward. Okay, and then now bend your knees for me. Okay, stand on one leg for me, please, on both sides. Yep, great. Hands on your side. Be careful. Close your eyes. And this is a Remember test, and I'm looking to see if there's any abnormality. And it looks like you have a minimal swing, and that's normal. Now I'm gonna do the finger nose test. I'm looking for coordination. Close your eyes. Open your eyes. Okay, so this is great coordination. Basically, if you were to miss those touching, there would be an abnormality. I'm gonna assess for pronator drift. I'm gonna have you put both of your hands up like this with your eyes closed. I push down and your arm is able to go down. That would be a positive pronator drift. Okay, I'm gonna check for coordination. I'm gonna ask you to wiggle your fingers for me. Okay, perfect. And put them on your knee and kind of flip them back and forth. Perfect. Now I'm gonna ask you to get one of your leg and kind of wiggle down to your toe. That's great. So it looks like you have good sensation. I'm going to do some more neuro check. I already did your face. Now I'm gonna do your hands, your chest, and your leg. And as we did before, you know, check for the dull and the sharp.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, and I'll do that bilateral. I'm gonna check for vibration, okay? You're gonna tell me when it stop, when it start, and when it stop, okay?
Start.
I'm going to use the Gnosis test. Guys, I'm gonna place an object in your hands, and you're gonna identify the object and tell me what object it is, okay? Close your eyes. Feel it? That's the sensation test.
Take the book.
Yes. Use the Graphistic test. I'm gonna write a number in your hands, and you're gonna tell me what number I wrote. So I'm testing for sensation still. What number?
The number 4.
Yes. This is called the 2-point discrimination test, okay? So you're gonna let me know if you feel 1 or 2 points, okay? Feel 1 or 2?
2.
Okay, perfect. So this I'm gonna measure. It's about 2.5 centimeters. So this is good. I'm gonna do your shoulders. You feel 1 or 2?
1.
Okay. All right. Let me adjust it. Okay. Do you feel 1 or 2?
1. 2.
Okay. So all right, I'm gonna measure that. All right. So this one is about 4 centimeters. I'm going to check for your deep tendon reflex, and I'm gonna have you relax your arm for me. Just curve and kind of go up for me so I can feel for the reflex. For the tendon. Okay, put it down. All right. So basically, I'm checking for your brachial reflex. Okay, ready? Perfect. So I need you to put all your weight into my hands. I'm gonna check for your bicep tendon. All right, right behind here. All right, and I'm gonna use the big part of the hammer. All right, ready? All right, so it looks like you have great reflex. It was a +2 respond. I'm gonna check for your brachial radial tendon right about here using my 2 fingers, and your hands about at an angle. I'm gonna ask you to clench your teeth for me. All right, ready? Okay, so I got a +2 response. I'm going to check for your knee reflex. All right, I'm gonna ask you to pull your arms for me. All right, ready? Okay, both knees. All right, so I got a very nice +2 response. I'm gonna check for your Achilles tendons, and I'm gonna put my hands under your foot. Ready? All right, I get a very nice +2 response. I'm gonna do a Babinski test. Okay, I'm gonna start from and then up. Okay, so if the toes are moving this way, so that's a negative test. For Gnosis reflex, so I'm gonna check for the plantar flex, dorsiflex. I'm gonna hold it and I'm gonna slightly let it down, okay? All right.